My name is Bernard Lukoya-Shikuku. I'm a public health officer by training, currently based in Oldonyiro Sub-County as a public health officer. And my roles as a public health officer include health promotion, disease prevention, all geared towards promoting good health of the communities and also to increase the lifespan. Part of the roles we undertake is issues which are relating to climate change. We all understand that climate change are shifts in temperature and weather conditions. Long-term shift, that is long-term shifts in climate and in temperatures and weather conditions within our areas. As you understand, Oldonyiro is one of the areas which have been affected with climate change and issues which revolve around frequent flooding and long-term droughts. Amref came in to support us to ensure that we formed what we call as we were trained as community-based observation networks, and part of our role include observation of data. At the same time, we discuss about the health impacts or the impacts, and then also observe what we call traditional observation. We record the data, and at the end of the day, do what we call data dissemination. This one has in itself helped us in disseminating health information, health-related data to our communities, and at the same time has helped us to reduce the caseload of malnutrition, as Oldonyiro is one of the areas which has high rates of malnutrition. When issues related to climate change, for example, when we have long-term droughts, they have a lot of impact in terms of community getting their daily food. And at the end of the day, we realize that most of our children, that is the under fives, are normally affected in terms of malnutrition. That is moderate acute malnutrition and also severe acute malnutrition. So this one comes as a result of the feeding habits, because during those times we normally have a shortage of food and water. We realize that our community is an ASAL community, that is they normally rely on there are pastoral communities which normally rely on the animals to provide them food, and also for the milk which they normally use to feed their children. So as an effect of climate change, we realize that our community have the challenge of accessing pasture, and this one has greatly affected the nutrition status of the children, that is the under five within the community. Climate change has impacted negatively on our communities. Some of the impacts which it has created is the long-term droughts, and this one has resulted in less pasture for the livestock. At the same time, there's also the emergence of zoonotic diseases. We have diseases like Rift Valley fever, which has now become endemic in our region as a result of the infestation of the Aedes aegypti mosquito, which is normally the causative agent. At the same time, we also have matters relating to food scarcity, and also when it comes to the quality of food within those areas is normally compromised as a result of the long spell in drought, and this one has impacted heavily on the nutrition status of our communities. Kenya normally has two rainy seasons, that is the long rains and the short rains. The long rains normally come in the months of March, April and May, and as we speak right now, we are expecting long rains in parts of Oldonyiro. In the course of this month, we have been able to register an approximate of 9 millimeters of rainfall, which just rained the other day. Through the Amref program, we have been able also to set what we call mother-to-mother support groups. These are groups which are normally comprised of pregnant and lactating mothers, and also women who have children who are under 5. So through the community-based observation network training, the mothers have been trained on kitchen gardening, and at the same time they've been able even to grow some of the crops, that is the vegetables. Initially, this is a community which is normally linked with taking milk and meat products. But as a result of the training which the communities have undertaken through the mother-to-mother support group, they have been able to be trained on crop production. And each and every homestead has what we call a kitchen garden, whereby they can grow some of the crops, that is vegetables, onions, tomatoes, and this will go a long way even improving on their nutrition. Now, the communities have really adapted to climate change, because by now, most of the community members do not have the large stocks of livestock which they used to have, which has been coupled by the long droughts which they have experienced. So they have been forced also to adapt mechanism for survival. And that is why right now they are no longer taking meat and milk only, but they are also adapted by growing their own crops, which they do in their small kitchen gardens at home. By this, they are able now to access nutritious food from the kitchen gardens, and this has gone a long way even to improve on our nutrition status. At the same time, we also have people who are called community disease reporters, who have also been trained on some of the diseases which normally affect the livestock. So they also bring information to the community during community dialogue, even during chief barazas. So this one has come a long way to sensitize the community on the diseases which are available. And once the diseases have been reported, they can get prompt action in terms of getting the necessary drugs which they normally use to treat the animals.
Robert Mateka. I'm working with Amref Health Africa in Kenya. Currently, I'm based in Isiolo. We're implementing a project on climate change and health. Our main objective is to enhance the resilience of the community to be able to adapt to the effects of climate change. Climate change is affecting communities in various ways, and more so the communities in Isiolo County because they depend on the natural environment for their livelihoods. So we're working closely with the county government of Isiolo and other partners to implement projects aimed at enhancing the resilience. So we are following two major approaches. One is on integrated One Health services. So we are providing One Health medical outreach services to the community, which are far away from medical facility. This is aimed at enabling the community to be able to prevent the zoonotic diseases that are affecting them. Additionally, we're working with the communities to enhance their resilience through community-based observation networks, where we're working with a section of the community to be able to disseminate some of the early warning information to enable the community prepare and make informed decisions that makes them to be able to adapt to the effects of climate change. Two major approaches. One, we are providing technical assistance to the relevant line departments in the county government to be able to work closely with the community through informed decision. Like today we were doing a session on for public health workers to understand climate change. We believe once they understand issues to do with climate change, they'll be better to anticipate some of the effects that climate change brings, to be able to manage when it comes, and this ensures that the healthcare system is resilient to the effects of climate change. Additionally, we have installed manual weather stations in the community where we have trained a section of the community to be able to observe and record daily weather patterns and use the same information to educate, to sensitize their fellow community on the likely effects of climate change and how it associates with health. So in the manual weather station, what there is we have a thermometer and a rain gauge. So they are able to measure daily temperatures, that how it fluctuates. And when they are doing the dissemination, they link it to the likely health effects. For example, if the temperature is so too high, there are health effects associated with it. For example, we're talking about dehydration, heat strokes, and heat shocks. So once they get this information, they advise the community on how to prevent such things through regular rehydration, avoiding a lot of exposure to issues to do with temperatures.
Naitwa Ali Alkano. Toka sehemu ya Kulamawe. Sisi tumepata mafunzo ya climate change. Hapo mbeleni hatukujua maana ya climate change, lakini climate change tumejua kutoka Amref, wametufundisha na jinsi imetusaidia, wametuwekea weather station. Ile weather station wametuwekea imetusaidia sana. Inatueleza ya kwamba kama mvua ni kidogo, tunapata ujumbe kutoka group ya WhatsApp. Na kama mvua ni nyingi, kama mwaka uliopita ilikuwa na El Nino, tulipatiwa habari mapema kwa group ya WhatsApp. Lakini hapo mbeleni hatukujua mambo ya climate change, lakini sasa Amref wametusaidia na tumejua mengi, na tumefunza community yetu wafugaji na wameelewa, na tunajua mambo ya climate change.